Hi, my name is Alyssa Nelsen and I'm with Knob Noster Physical Therapy. And today we're going to be discussing osteopenia versus osteoporosis. So these are terms that you may hear in your daily life from maybe your doctor or from a family friend or a sibling, parent, anybody that may be suffering from these conditions. So osteopenia and osteoporosis are two different definitions for a very similar condition, just depending on the intensity in which it is happening. So osteoporosis is the more severe form, and that is what we call brittle bone disease. So it's an area in which the bone that we have within our body is more porous, doesn't have as much density, which means that it isn't as strong. So maybe you've had a DEXA scan, maybe you know somebody that has had a bone density scan. So the cutoff rate there for osteoporosis is negative 2.5, which means that your bone density in your bones is actually 2.5 times less than somebody at the age of 20 to 30. So that's kind of how that's a test that they use to kind of determine that level and that cutoff. So osteopenia is actually anything between -1 to -2.5, and a normal would be anything higher than a -1. In our body, we have a couple different cells that will build and break down our bones. So our bone is a living tissue, and throughout our life, it is constantly changing. So your body reabsorbs the bone using osteoclasts. So they will go in, break that bone down, and kind of tear it apart. And then you have osteoblasts that will come in and help build that bone back up. So normally this is a great process because if we are challenging our bones, if we're putting force through our bones, our body will come back through and see that there may be some little micro damage or some issues within the bone. It will break that down and rebuild that bone back stronger. However, with osteoporosis and osteopenia, our body is no longer doing that section properly. So you're having the osteoclasts that are taking over at a much higher rate than your osteoblasts. So you're reabsorbing that bone much faster than you're laying it down, which is what leads to that decline in bone density. There's a lot of ways in which we can help this and prevent those, which we will cover in some future videos. As always, if you need anything, feel free to reach out to the clinic or check us out at knobpt.com.